of what those three principles are: that it meet the needs of everyone, that it be free at the point of delivery, and that it be based on clinical need, not the ability to pay. The questioner asked what's happened to those principles. Sean, are they still in place under these reforms that you helped formulate?
Well, my main point on that would be that the reforms have to be put in place in order to preserve those principles. The alternative is, as Anne I think is kind of intimating, that you just keep pouring more and more money in. As I said, there is a growing and ageing population over here. There are rising costs of treatments and technologies over here. There are people in the middle who just want the best possible care they can get. You know, if you don't reform, those principles are gone. You know, but when you do get to the point where people are talking about American-style healthcare systems, I don't think anybody in this country wants to actually put us in that position. Now, if you want to preserve the NHS, it's got to change, not hugely, but in parts. In competition, I don't think is the answer, but in some areas it works. And
just to clarify on the question I asked Anne, then, you are singing from a similar hymn sheet. The need for reform is driven by finite resources, i.e. you can't carry on spending money, and increasing demand, which surely eventually is going to compromise meeting the needs of everyone, free at the point of delivery, and ultimately the clinical need, not the ability to
No, because that is always going to be a political decision. If you want an NHS that gives people care free at the point of use, you have to pay for it, and that's a decision that politicians take. But the point is that is a massive driver of change. But that's not the driving motivation that should lead politicians to want to reform the NHS. That should be equality in what people want. But of course we want to keep it, as Andy said, we want to keep it free and everything else. But you can't do that if you're going to sit around and try and hark back to the 1970s and have no competition, no different providers, and the trade unions and the Labour Party running everything.
Well, we do need to reform the system, but it's service reform that we need, not structural reform or more competition. We need to fully integrate health and social care, which is something I propose. We need to start in the home with all of the support people need, preventing them going into hospital. The big flaw in what Anne and Sean have said is that they are saying that more competition equals more efficiency. I'm afraid there is no evidence anywhere in the world that more competition in healthcare makes it more cost effective. If you look famously at the US, it doesn't even provide comprehensive universal healthcare to its population, and yet it spends 18% of GDP on healthcare. We spend 9% of our GDP on health. Why? Because when I was Secretary of State, that N in NHS gave me the ability at national level to plan how we were going to do things. What were we going to pay the staff? Where are we going to put our specialist services? What's the national entitlement to treatment we're going to be able to provide? So because you can set that at national level, you get the ability to control your costs. It is inherently a more efficient way. And if we rip that up and throw it away, we will be spending more on healthcare down the line, not less, and that's the big flaw in what they've both said.
So the tension then is between being such an enormous customer that you win yourself the best deal by negotiating on a national level. Sort of monolithic, perhaps would be a negative description, but one can see the positives, and the alternative would be competing, because most customers, when they go shopping, everybody in this room when they go shopping knows that they will be better served as a customer if the people trying to sell them something are in competition with each other.
Well, let me give you an example though, in healthcare. If you go to regional or local systems of pay, you end up finding that it costs you more, not less, because you build in a competitive pressure where the staff start saying, well, they're getting paid that over there, and we want to get paid. You build in a pressure at bottom level that builds and builds and builds over time. It's much better just to be able to set it nationally, and therefore you don't have one area trying to poach staff off another, because there is a clear national standard about what needs to be provided, and that underpins a stable, successful, cost-effective national health service.
But you introduced the private sector into the NHS and expanded their role year on year and paid them more for doing the work that the NHS did.
But Sean, why did we do it?
You're now denying that.
No, I'm not. Why did we do it? We did it to add capacity to the NHS, to bring down the month, if not year-long waiting list that your government left behind in 1995.
Gentlemen, the news waits for none of us, although we have, as people listening at home will have noticed, got rid of the travel news for this half an hour. You're listening to LBC 97.3. The time now is 8:30.